I'm talking to Aleksey Lakhov, who works with Humanitarian Action in St. Petersburg. Humanitarian Action are one of the foundation's grantees. Aleksey, introduce yourself and tell us a little bit about Humanitarian Action and what you do there.
Our foundation has been working since 1995. And at first we helped children who were living in the streets. And then we started helping people who use drugs. And that's what we have been doing for the past 20 years. We have the oldest harm reduction program in Russia.
I remember visiting quite a long time ago and seeing the work of Humanitarian Action, and particularly talking to some of your young clients and just thinking, thank goodness for you, because if you weren't there, these kids are so incredibly vulnerable. Very difficult and challenging work to do. And now you have COVID-19 on top of that. I know with our grant, you have repurposed some of the funds. Tell me a bit about how you're flexing, how you're changing what you do in order to be able to function.
The year before this onset of COVID-19, we created several Telegram chats and channels for our beneficiaries so that they could receive an up-to-date information about our services, such as working schedule of our mobile units and so forth. And also these means of communication were used by our case managers and peer counselors to get in touch with beneficiaries directly, and as well as by our doctors for remote counseling. And that's why we were quite ready for this lockdown. We estimate that the number of people who have been receiving our help during this lockdown is 50, maybe 60% less than these pre-pandemic times. So now we resumed the work of our mobile units, and we hope that we will be able to return to these pre-COVID levels. But of course, it will take some time. Now we have been working with people who use drugs mainly. These are older people. They have been visiting our mobile units all these years, and we are really trying to help them to not get infected with HIV, with hepatitis B or C, with syphilis. We provide them with harm reduction kits. We provide them with doctors' services. We provide them with help in receiving ARTs, some other medications, and so forth. And that's why we really believe that this work that we have been doing on our mobile units is very important, because when a person goes there and when he or she walks in there, it's like a safe place for him or for her. And this is a place where you can receive a whole range of services.
And what's your constraints like? How do you as a member of Humanitarian Action, how do you protect yourself?
Mm-hmm. In large part to this Lighthouse program that we have been carrying out, we were able to buy protective equipment like gloves, like masks, like hand antiseptics, and also we were able to distribute them among our clients.
It's extraordinary that you've been amazingly flexible and innovative. What's the feeling in Russia about COVID, and how are people feeling about that issue at the moment?
Russia is one of the hardest hit countries. We have more than 500,000 cases already, and this number has been increasing, unfortunately. As for St. Petersburg, we have more than 20,000 cases. This is the third hardest hit region in our country. The main theme is that nobody knows whom to trust. One person says that everything will be all right soon, and then another says that nothing will be normal for at least a couple of months.
I think all over the world, there's this sort of contradiction between different medical experts and politicians. And I feel like there are some echoes from the early days of the AIDS epidemic, when the medical profession was kind of trying to figure out how HIV was spread, what we might be able to do to treat people's symptoms. And and politicians were scrabbling to figure out what the public health response should be and how they should inform the public and so on. And certainly there's been a bit of that with this COVID epidemic, that you feel like people are rushing to catch up rather than ahead of it. Why is it important for you to continue to do the work that you're doing with people who use drugs around HIV?
They are one of the most affected ones, and they are one of the most vulnerable ones. Because, for example, among our beneficiaries, there are a lot of people who had just manual works, and when this pandemic hit, they were out of work, and now they do not have enough money to support themselves and to buy some vital medications. They do not even have money to get to the AIDS center to receive their ARTs. This definitely affects their health in a negative way. And that's where we were able to help them.
Some people might think, and I know that this is a challenge in Russia as well, for many people, that the idea of supporting people who are using drugs is questionable when there are other people, supposedly innocent people, who perhaps are more deserving. I'd love you to sort of explain why it is that people who are in the situation that a lot of your clients are, why you feel it's still essential to show them the love and support and compassion that you do.
This negative attitude towards people who use drugs, towards people who live with HIV, it's been really prevalent. I believe not only in our country, but in other countries as well. And when you have elder people, when you have pensioners and you have single mothers, for example, people always ask you, why do we have to help, drug users when we can help a single mother, for example? That's where we need to explain that actually a lot of our clients, there are a lot of single mothers as well. The first thing that we are trying to explain is that, and this is actually like a long-term investment in the future of your own country. The less new HIV and hepatitis cases you have, the less burden your health system is encountered. We need a lot of patience and a lot of compassion towards those people whom we are trying to explain these things to.
And as you say, that isn't unique to Russia. People's lives are very fragile, and things that happen, whether it's unemployment, poverty, abuse, those sorts of things, really can tip people's lives into an incredibly fragile state. I feel at least a little bit that people are starting to understand that, the classic sort of stereotype of a drug user as someone who's, young and indulgent and lazy and that sort of thing is starting to change, and people are starting to understand that actually, abuse, alcohol or drug abuse, is very often a function of real pain and lack of connection and loneliness and panic and so on. And seeing it more as these are people who really are incredibly deserving of our love and support and compassion, not our judgment and our punishment. Now that you're able to start the mobile unit again, and you're able to start providing services to people directly, and you're also helping connect them to the AIDS centers and to getting the support they need, what are the biggest challenges that you find they're facing other than that?
Personally, I believe that we haven't seen the real consequences of COVID-19 yet. That's why we are really anxious when a lot of children go to school, when a lot of people return from their dachas, as we call these these countryside houses in Russia. Maybe there will be the second wave of COVID, and maybe it will be harder than the first one. There's a good proverb saying that you should always hope for the best, but prepare for the worst. And that's how we are trying to operate right now, one day at a time, carefully resuming our operations.
With so many people that Humanitarian Action is supporting, there's obviously a lot of very sad and very challenging stories. I wonder if you could share with us something personal about your connection to some of the people that you help, and maybe some of the good that comes out of it on a personal level.
Not long ago, we started this self-testing initiative, and two of our long-time beneficiaries, both of them are HIV positive spouses. They ordered these tests for their own kids, their teenage sons. Really wanted them not to repeat our mistakes. I think this is a very powerful, simple, and positive message that in spite of this pandemic, life goes on.
How do you feel positive, and what makes you get up in the morning? What gives you the energy and the kind of commitment to do this work that you do?
I am a former drug user myself, and that's what keeps motivating me in my everyday activities. Just because I've been there myself, and I want to help people change their lives for the better.
We and thousands of other people are incredibly grateful that you do it. It's hard, isn't it, to get across to people the enormously fulfilling and redemptive power of helping other people. It's something that people have touched on in this coronavirus pandemic, that we've rediscovered the enormous sense of fulfillment in helping other people directly, helping people in your community. In the future that you imagine for this work that you're doing, where would you like to be in 5 years' time?
We would like to become a really an all-Russian organization that helps people not only in St. Petersburg but all over Russia. And by this help, I mean not only directly providing our services, but also teaching other organizations how we are doing things, like sharing our experience. This is a very important part of our work, to show people that everything is possible, actually, that it's even possible to carry out harm reduction programs in Russia, where substitution therapy is banned. We have more than 1,500 people on our social and medical support right now, and I believe that this amount can be much higher. We would like to become an integral part of the civil society.
We know that the epidemic, the AIDS epidemic, is growing faster in Russia than it is in many other parts of the world. So I feel like when you talk about sharing experience and maybe even having things to teach, if you can make real gains in some of the places where it's most challenging, then you learn the best lessons and you really do have a lot to share. Well, we share your passion, Aleksey. We share your dream. We're deeply grateful for all the work that you do and for sharing some of that with us today. There will be more information about the Foundation's work and about other resources which you can check out from our website. But in the meantime, thank you so much for sharing some time with us and telling us a bit about the amazing work that you do. Good luck with it. Stay well, stay safe, and hopefully we'll see you again in St. Petersburg.
Yeah, and thank you, because without your help, a lot of things that we have been doing for the last 5 years, they just won't be possible.
Let's keep at it. Thank you, Aleksey. Спасибо. And
You're welcome.
Bye.
Bye.